Top Med Talk. Okay, hi, Monty Mythen here, Editor-in-Chief of Top Med Talk, coming to you live from Anaesthesia 2019, here in the heart of London, near St Paul's, the Cathedral. I'm sitting down with a friend of Top Med Talk, loyal supporter, Professor Mike Grocott from Southampton, and College Council member, just elected as...
Vice President.
Vice President of the Royal College of Anaesthetists. Get that. What's happening there, Mike? Do you get a car? Do you get a driver?
No. You get all the jobs that Ravi doesn't want to do. The president.
Ravi Mahajan being the president. And you're one of two vice presidents, aren't you?
Yep.
Who's the other?
Fiona Donnell.
Excellent. What fantastic choices. Well done, both of you.
Thank you.
And you're taking over from previous vice presidents?
From Janice Fasakali.
Yep. Who we were just chatting to.
Indeed.
Yeah. Did a fantastic job.
And Simon.
And Simon Fletch.
Fletch, as we call him.
As we call him. Now, we've just been joined by a person who's taken on a job that we've been talking about on Top Med Talk now for a few weeks, if not months. This new Centre for Perioperative Care. What's that about, Mike?
So launched yesterday at Anaesthesia 2019, a multi-specialty, multidisciplinary centre based at the Royal College of Anaesthetists, but pulling together professionals from across the healthcare spectrum, focusing on improving the care of patients undergoing surgery. And
you just announced the new director,
yes.
Who is?
I could let him announce himself. Who is?
Is that why he's sitting here?
Yeah.
I wondered who you were.
Hello, everyone. David Selwyn.
David, well done, mate. So congratulations, all joking aside.
Yeah, thank you. I'm really excited. I think it's a huge opportunity to improve the whole surgical pathway for our patients, and a huge opportunity for the college and all of the colleges to really drive forward some of the strong background that we've done with the perioperative journey so far.
So Dave, I think I'm right in saying that you've got considerable operational experience in the NHS. Is that a reasonable way of expressing that?
I think that's probably fair. I've had a fairly tortuous leadership journey from a sort of lead clinician, well, before that actually as a regional advisor for about 8 years, and then as a lead clinician up through a clinical director, divisional director, and deputy medical director.
So you know how to get things done in the NHS, and you know why you can't get some things done in the NHS. Where's your glass? Half full, half empty from that perspective at the moment in the NHS?
Half full.
Good man. Otherwise you wouldn't have got the job, I don't think.
Yeah.
So how's the centre? What's the short-term goals? Are you allowed to tell us what you told them at interview that you'd get done?
No, you don't want to hear what I said at interview.
You got the job.
So in effect, this is initial 3-year program, and we've set up some short-term goals over the first year, really, and that's particularly around structure and process. So that's setting up the centre, setting up the governance, setting up the various groups, and driving forward some of the initial areas of focus that have come out of the previous work and the back of the PQIP programme, all of those sort of aspects. And then into the second and third year, it's obviously slightly depends on how things go, but it's more about setting up perioperative care as on a much more formal basis, involving all of the multiple stakeholders. So remember, it's not just anaesthesia or critical care that are involved in this, it's all of the other colleges and all of the other specialties. And it's seeing where we can take that and where we can get to with the whole of the concept.
So Mike, tough decision choosing the leader for this role. You had some fantastic candidates.
We had some really excellent candidates. Who I hope we will see again. So there's going to be other roles advertised, as Dave knows. There's a deputy director, there's a fellows role, and there will be I think a substantial number of leadership roles across the centre. But yeah, some really great candidates came forward.
So if people want to know more about CPOC and want to get engaged with the CPOC journey, where do they go to? Well, Dave now.
Obviously, email Dave directly. I'll just give you his mobile phone number. So I think very much via the college at the moment. CPOC, the Centre for Perioperative Care, is now on the college website, and there'll be contacts there for the admin team, and we are really seeking engagement and looking out. I think it's fair to say, Dave.
Is it a physical thing or a virtual thing or a bit of both?
So I think the vision would be that it will be a bit of both. So initially, it's mainly about, as I sort of described, creating the structure and the processes. But actually, in the future, there's the opportunity for it to be very physical.
Excellent. Well, as the stuff I've seen is that I think it's got 6 major themes at the moment. It's got improving quality of care, supporting patients, supporting professionals, influencing policy, technology and digital research and innovation. And that's going to fix the world as we know it. The only reason I know that is we're sitting opposite this stand. So over your shoulder, I can read the pull-up that has the 6 bullet points on it. Did you know that that's where your themes were?
Yeah, I think I had a slide on that in my interview.
In truth, we're building on what you led at the college, Monty, in terms of the Perioperative Medicine Leadership Group, and starting to flesh out, the clinical guidelines, making sure the guidelines are implemented, and the policy piece, I think, fits very neatly with the college's approach, which has been much more outward-looking and policy-focused in the last couple of years, and I think that's got traction. Dave, I know you weren't here yesterday, but it was really gratifying. So Aidan Fowler, National Director of Patient Safety in England, and one of the Deputy Medical Directors of the NHS, the Department of Health and Social Care. And so a couple of name checks, very excited that the NATSIPs, the National Safety Standards for Interventional Procedures, were going to be adopted by CPOC. So I think there's a huge opportunity in terms of that kind of impact.
And we would appear to be the envy of many parts of the world. As we've been around doing interviews, they've seen the perioperative medicine journey, the college anaesthetist, and now this final. The final is the wrong way of saying it. It was the 5-year part of the vision was to work towards, if it all went well, this multidisciplinary cross-college endeavour as a Centre for Perioperative Care. Do you think a risk of leading too much of it? How are we going to not make it just an anaesthesia thing?
No, I don't see that as a particular risk. I think there are so many other stakeholders involved that we will get their benefit and their insight and their help. Obviously, anaesthesia has a key role in all of this, but I think this is about changing the whole pathway and designing and developing something that is better for us all, and particularly better for our patients. I think the aspect for the global strategy is interesting. I think hopefully we can really make some progress here in the UK, but we'll be obviously talking with counterparts across the world, and hopefully they'll be talking with us, and we can tie all of that work in.
And internally, I mean, my experience, and you followed on from me, Mike, for the perioperative medicine thing within the college, I'm just really gratified how supportive the other colleges were. None of them saw it as some sort of pitch battle. They all seemed to say, we're all in this together. We've got this challenge if we're going to continue to look after patients as best as we possibly can. We've got limited resources, so we've got to go at it together. And any resistance in this new step?
Not at all. And I remember you reflecting to me that and I always felt slightly sceptical about it, but having sort of gone around the same round of meetings, it's completely pushing at an open door, and I think huge amount of enthusiasm and support for this.
And political support as well. I think we're hitting a sweet spot with some of the digital innovation that's coming on board, and the political agenda as well. So hopefully we can really drive this forward.
So the technology and digital bullet point. Any thoughts as to what you're going to do about that in the short term? It's a lot of buzz about. We're doing a thing this morning, the AI this evening. Sorry, we're doing an event this evening about artificial intelligence, a sort of small group conversation about AI, machine learning. It's a very buzz topics at the moment, but aren't there simpler digital things we could be getting on with?
I think there is a scope of this. There are simple things to use technology to make our lives better, and the recent Topol report was talking about giving us back time to enable us to do things, and I think that's very welcome. I think if you look at some documents such as the Future of Surgery from the College of Surgeons, clearly surgery is not just that actually technology is changing, the whole of surgery is changing, and the type of surgeons that we'll produce, as well as the type of techniques that we use. So I think all of those things are coming together, and of course a key aspect for us all is sharing the technology and using data to make these decisions. And the digital health record is an absolute key component of this and where we get to with that.
And a lot of this builds on activity that's going on out there. I mean, particularly so app development. I know of several apps in different places around the country that people are driving. I think there's a very healthy competition in that regard.
And we must be liberal about that. I think that these things get difficult when people become controlling in the whole thing.
Absolutely.
Yeah. So, any final thoughts from you, Mike, before we let the
delighted to have Dave taken on this role. Great to have launched the whole thing yesterday. I think you got a real following wind to start with, and really looking forward to seeing it grow.
So Dave Selwyn, new director of the Centre for Perioperative Care, currently housed at the Royal College of Anaesthetists, but a big tent open to everyone. Final thoughts?
Yeah, very exciting for us, very exciting for our patients, but actually for the people who are listening to this, please get involved.
Get involved. Thank you very much indeed. Top Med Talk.
Nick Majerison here. Thanks for listening to Top Med Talk. Now, before we let you go, it's important that we remind you to subscribe to Top Med Talk. That way you'll never, ever miss another episode. Also, if we could encourage you to join us on social media, Twitter, Facebook, LinkedIn, YouTube, pretty much every single social media platform, we're there. Join us. And finally, check out topmedtalk.com. If you go to our website, you can subscribe to email updates. That way we can always tell you where we're going to be, what we're going to be doing, and how you can join us. topmedtalk.com, and click on the section marked email updates. Finally, Top Med Talk is proud to act as the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about them as well. ebpom.org is their website. That's ebpom.org. And if you go to ebpom.org/meetings, you can find out about some of the wonderful meetings that we attend and cover across the year here on Top Med Talk. That's ebpom.org/meetings.